Yeah, welcome you all. Today we are having our guest, Dr. Madhukar Pai. Dr. Madhukar Pai is a consultant laparoscopic surgeon with 17 years of experience in basic and advanced laparoscopic surgery and general surgery. He has been an operating faculty in various national conferences, has co-authored various articles at international journals, and has also co-authored a textbook on laparoscopic hernia surgery. He has coordinated various events and CMEs and was credited with the Best Doctor Award in 2014. So there are a lot of other credentials added to his career as well as his education. He has taken a lot of fellowship and is an experienced surgeon, especially in the field of laparoscopy. So I consider it as a great privilege and honor to have him for a discussion today. So welcome you, sir. Welcome, Dr. Madhukar Pai. Welcome.
Thank you.
Okay, so in this interactive session, we are planning to have some questionnaire for a layman point of view. A lot of people are suffering from varicose from adulthood, or even the children are having. So at which stage we have to undergo a medication or think about surgery, sir? At what level?
Any disease, you have to think about the treatment if the disease is causing any symptom to you. That is the first thing. If the disease is problematic, or if the delay in the treatment may cause a major issue. These 2 points we have to always consider while going for any treatment. If most of the females after delivery, I think they will have small spider veins on their leg, and for a lifetime it is not going to do any harm for them. So are the veins causing any trouble for them? If the veins are troubling them, they need to be treated. Or if you delay the treatment, like some people, large varicose veins will be there, but they are not at all bothered about it because it is not causing any problem to them. But if you delay the treatment, it can lead to ulcer formation. And once the ulcer forms, it is very difficult for that the ulcer to get cured, even if you treat the varicose vein. So these 2 points we have to always consider. What is the problem with the disease? How we are affected with the disease? How our daily life or daily routine is affected with the disease? And what is the problems with the delay in treatment? These 2 things, if we consider, I think we'll get the answer for that. If a swelling is there, very small in size, it is not at all hurting, and it is not tumorous, so that it will not, in a long run, it is not going to make any problem. Some people, all the people will have small swellings in the face and all, which will remain like that for years. Those cases needn't get operated because that disease is not going to do any harm for them unless that problem which the patients can face will be from a real pain or up to even cosmetic things like a small scar on the face, but it is if a film actress or something like that, that scar can trouble her.
Yeah. So some people are telling that having vitamin E supplements may reduce the inflammation for the spider vein or the varicose. Is it true, having vitamin E?
No, it is just it boosts your mental esteem. That's all.
Okay.
Once these veins dilate, they are not going to come back.
Okay.
They are dilated.
Okay.
So they will never come back.
And
vitamin E is we usually give it for thrombosed varicose veins, the varicose veins with blood clots. So in the clot formation and all, that clot's dissolution, it has some role. Only for that reason it is given.
And one more thing, sir, while like home remedies for this varicose vein, like for a sports person who is doing a lot of muscular activities and all, they have to provide the stockings or the necessary support while being in the gym, or while the sleeping pattern also. Some people are insisting for pillow. We are keeping the legs over the pillow in order to maintain the blood flow. And what are the home remedies? This will be like if we are following this kind of life patterns, somehow how we can somehow control this varicose vein, right? Or anything relevant to it?
No, this home remedies, I think varicose vein don't have any good home remedies like that. I think the only thing will be uh, to remove obesity. If you are obese, take care of obesity and your working pattern, because varicose veins do happen if you sit or stand, but they don't happen if you lie down with the leg elevated or you walk. So once you are having a varicose vein, you can think about lying with a pillow under your feet. But if you are not having a varicose vein, don't think about every time keeping a pillow, because I think during sleep you may turn around and the pillow won't be there. Your leg won't be on your pillow. Then the other thing being told is just keeping bricks beneath the foot end of the bed, so that the entire bed becomes leg up. But it can increase your regurgitation and all. So it will cause more harm. So don't think of get afraid of varicose vein. Do something so that you get an esophageal reflux disease. Don't do anything like that. And only thing, positive thing will be reduce your weight if you are overweight and be more active rather than simply standing or simply sitting. Sitting idle or standing idle can lead to varicose vein. But we cannot avoid it in some professions like traffic police. He cannot do anything on it. He has to stand. We surgeons, we have to stand. We can't do anything. Such people can use talking. It is not for all. Only those people who has to undergo prolonged standing.
Okay, so what are the remedies? Like only surgery is an option if the varicose is beyond a limit or you need to cure the present condition. Only surgery, like laser treatments are there, then open surgery, then keyhole surgery. So what is the best remedy for treating varicose rather than medication?
Varicose vein as such doesn't have any medications for cure. Similarly, these lifestyle modifications, they will just help you out. Varicose vein won't increase with this lifestyle modification, but once varicose, the vein will never come back. As I already told, during pregnancy, the females getting small spider veins. With conservative management, these spider veins won't vanish. They will remain like that innocuous. Likewise, varicose vein will not increase with these conservative treatments. For cure, it requires surgery only. That surgery can be either open surgery or a sclerotherapy or a laser or a combination of all these.
Sir, which one you will be preferring? Which is the best alternative among these? Laser or keyhole? Like
We can never say like that, because just let me ask you one question. I want to go to Goa. Should I go by flight or should I go by train?
yeah.
Our requirements, our preferences. Or I want to go to Delhi. I want to go by flight or I want to go by train. At times we want to enjoy that Rajdhani Express or something, and we go one trip by train, we come return back by flight or something like that. That is a personal preference.
Yeah.
Likewise, when you are having a disease, it is that disease determines the treatment. Not that I like paracetamol. So if I get vomiting, I will have paracetamol for that. I think that is not right.
Yeah, exactly.
Similarly, if a varicose vein requires surgery, it should be operated. Laser should not be done for that. Similarly, if a varicose vein needs sclero, surgery and laser won't help. Only sclero will help. So based on the disease you are having, you have to have the treatment rather than your or surgeon's preference. No, it is nothing like that.
Sir, once
I won't have a preference, and the patient also doesn't have any preference.
Yeah.
Based on the disease what he is having, he has to undergo the treatment.
Okay, sir. Once if a patient undergone a surgery and has totally recovered, what is the chances of getting this problem again? Is there any? Is it recurring or it will be completely gone? Any chances of coming? The varicose vein may come back, like any other places, or what? Is it related with genetics or like something like that?
I will never say zero to genetics, because very, very rare collagen diseases can have varicose vein. But it is not at all seen in our scenario. Genetics is not at all seen, right? Then coming to whatever diseases you are having, because of lifestyles, the first thing you have to do is lifestyle modification. Any disease which is having a lifestyle causative, that lifestyle need to be modified. Like you are having cough, you may be a smoker, then you have to quit smoking first, then treat the cough. Likewise, varicose vein also has got some lifestyle modifications needed. After surgery, if the lifestyle is not taken care, this one more thing I will ask you. That is, most of the patients do ask me, if we remove the veins or we cauterize the veins, how does the blood flow? Because veins are needed, right?
Yeah.
There are some 10 or 20 veins going there. Even if that vein which is damaged, through which the blood is not flowing, it is lying stagnant there, we are removing. But there are other veins. So if we don't follow the lifestyle changes, we don't modify our lifestyle, those normal veins can undergo varicosities.
Yeah, exactly. And
Whether I may not be right in saying that that is a recurrence of varicosity. It is not a recurrence. As of now, you or me doesn't have a varicose vein. Now we are getting a varicose vein maybe after 2 years or 3 years.
yeah.
Likewise, we have cured the varicose vein. The patient is varicose vein free. He is not taking care. Maybe 2 years, 3 years later, he is getting one more episode of varicose vein. Just like a normal person getting it, because the lifestyle modifications are not followed.
Yeah.
It may not be counted as a recurrence of varicose vein.
So similarly, hernia also only surgery is a remedy. As I had seen a lot of your videos in some of the leading channels and all, and it was quite informative also. And one more thing, like the procedure of keyhole, because nowadays many people may not be knowing, like traditional open surgery may take a lot of recovery time, and when we are going for a keyhole, like 2 days, we can go back to your home and join our normal lifestyle. So in the keyhole surgery, we are using some techniques like a camera, then something like that. So can you please explain in brief the procedure for common people for knowing that?
Right. The from the name itself, you can imagine, you can just think in front of you the keyhole of a room. You want to take a pen from this room in which I am sitting. You are not there in the room, you are standing outside. You have two different options. Open the door, come inside, take the pen, go out. Maybe when you are coming in and you are taking the pen, maybe the stool or something is there is that seat, sofa or something is lying somewhere around. You may be rectifying it. You may be doing something other thing, some cleaning or something you are doing, and you are going out. So when you are coming in to take the pen, you are doing a lot of other things and you are going out. Instead, you are just putting a small thing through the keyhole. Locate the pen, catch the pen, take it out through the keyhole of the door. That is keyhole surgery. So the damage made inside is much less.
Yeah, it is the best way of narrating the main concept. Very simple words, and the concept is very much cleared. But while doing the procedure, I don't know exactly. On camera, we are viewing all these things. And what are the complexities associated with a keyhole surgery compared to an open surgery? Which one is less complex?
Keyhole, it requires more skill, but it is easier.
Exactly.
It requires more skill, but it is easier. In that, a camera goes in mostly through the belly button. there'll be a 10 millimeter hole in the belly button through which a camera goes in. It shows us 20 times magnified view of what is there inside. And it can go to any portion of the abdomen. Just imagine when the camera tip goes towards the stomach, you are seeing the stomach with that clarity, like you are putting your own head into the abdomen of the patient and looking into it. That much magnified view we are getting. So even minute structures, minutest of the nerve, all those will be clearly seen in laparoscopy. That magnified view is there. And also the damage done to the tissues, it is lesser. Because the other open surgery, we have to put our hands in. So the abdomen we are opening and closing. So that scar related issues, rust related issues, scar related issues like a hernia and all, rust related issues, patient needs to have rest for at least a week or so that he can develop post-operative pneumonia, deep vein thrombosis. All those risks are very less in laparoscopy because the rust related risks are not there, scar related risks are not there. And regarding pain is also reduced. That is also a point which is in favor of laparoscopy. The amount of things which we can do inside, like combination of procedures. In olden days, a gallbladder removal and a uterus removal cannot be done because gallbladder removal cut comes above, uterus removal the cut goes below. This cannot be combined because we cannot make simultaneously 2 incisions on the abdomen. It will be very painful for the patient. But with laparoscopy, you can turn the laparoscope to any side. You can remove the gallbladder, you can remove the uterus, ovary, whatever is diseased. Combination of procedures is possible by laparoscopy. Then early rehabilitation of the patient. The same night the patient can walk to toilet and early back to work. That is within a week he can join work. All these do favor laparoscopy. And in a lot of surgeries, laparoscopy can do a better job than an open surgery, especially malignancies of the lower rectum, hiatus hernia, all those cases, even gallbladder surgeries, laparoscopy can deliver a better thing when compared to open surgery.
So regarding this gallbladder, one general doubt is there, like we are having some acidic nature or weight gain or weight loss, maybe the like related to thyroid. Thyroid may lead to weight gain and weight loss, and similarly some acidic functionality. And at what stage a person has to undergo this gallbladder surgery? Like sometimes you are taking the scan and it is showing this much range is there. But what is the specifications or what are the conditions, like symptoms, which we have to consider while planning for a consultation or a surgery?
All the symptomatic gallstones needs to be treated. Symptomatic means the patient is having abdominal pain or acidity. He has done a scan. We are seeing a stone. It is a symptomatic gallbladder. Symptomatic gallbladder needs to be treated. When only doubt comes is asymptomatic gallstone. You are doing scan for some other reason, like for health check or something, you are doing a scan. You are seeing a stone. Then whether the stone needs to be removed is always remaining a question. It is always a question. And I think some people are taking it in a wrong way. And even for symptomatic gallstones, they are thinking like, no, we needn't undergo a surgery. It is never like that. Gallstones, if symptomatic, surgery should be done. That's laparoscopy, it should be done. If it is asymptomatic, then comes whether it is a single stone, whether it is a small stone, whether it is a big stone, what is the condition of the gallbladder wall on ultrasound scan. All those things come into consideration. Whether the patient is having diabetes, whether the patient is planning any travel or something so that immediate medical attention cannot be reached. All these are indications for surgery. Immediate medical attentions cannot be reached means they are thinking even of a flight. That is what is given in the literature. If it is a small stone, it to be removed because it can pass down. If it is a large stone, because if it pass down, it leads to jaundice, pancreatitis, and all. If it is a large stone, it needs to be removed because it can block the gallbladder and cause infection. If diabetes is there, we have to remove because it will be infection may be painless and the patient can go in septicemia. If the patient is planning any travel so that immediate medical attention cannot be sought,
Okay.
then also it needs to be operated.
Okay. Okay.
So taking into consideration all these factors, I am very doubtful which is the patient who should not be offered surgery. Because if it is small to be removed, multiple to be removed, large to be removed, if diabetes to be removed, if the patient is planning any travel or something needs to be removed, then who will be the other patient who can be treated conservatively?
Yeah.
Because every patient will fall in any of these criteria.
Yeah.
Only thing is 1 in 20 of the gallstone can lead to trouble. Not all the gallstones can lead to trouble, but science doesn't know any of the fields of the science. I'm not talking about allopathy alone. Nobody can predict which is that 1 out of 20.
Exactly.
Even with your food, you are taking care. Like you will not have food from an unhygienic or something like that. You will say, if the food is not right, I may get sick. Even with that small thing, you don't want to take risk with your life. But this 1 in 20 is a very high number.
Yeah. The probability we can predict. Yeah, exactly.
Yeah. Because any smoked things and all we may not take, we'll say cancer may happen. That risk is not 1 in, but we won't have it. But this 1 in 20 is a very high risk. But when considered to the other 19 patients, we can think that, okay, we can avoid a surgery. But once we postpone the surgery and do a gallbladder surgery, once it is complicated, the outcomes are different. A complicated gallbladder surgery and a simple gallbladder surgery, the outcome is very different. Hospital stay is different. Post-operative, the difficulties of the patient, like if the patient has jaundice, even if we remove the gallbladder, that recurrence of the cholangitis, stricture formation, all those are there. Very, very rare chance. 1 in 1,000 only gallbladder stones can later develop into malignancies or cancers. But once the gallbladder carcinoma happens, chemotherapy and radiotherapy may not be of much help to the patient. So why should we take a risk of keeping that inside?
Yeah, exactly.
Olden days, it was open surgery only, and the cut which made caused pain. So people were thinking like, now it is not hurting. Why should I make a cut and get a hurt? But when with the advent of laparoscopy, the surgical procedure is very simple and it is just one muscle, and the gallbladder can be taken care of.
Yeah, so we had a detailed idea. I mean, in a briefly but beautifully on a narrative way, like a layman point of view, like we got a visualization regarding the keyhole and all in simple words and terminologies. Dr. Madhukar Pai has explained all these concepts. So I think it was quite informative, and like I hope that like lifestyle changes can also lead can lead to a better living, right? As sir has mentioned, all these things are related with lifestyle also. So thank you, sir, for spending time with us. So I like your service is always required for the society. I had gone through your videos in the news channels and all. It was highly informative, and I'm really happy and blessed to have you today for this interactive session. It will be quite beneficial for the society. And yes, sir is a consultant at Lakeshore Hospital as well as in Adapalli also. He is having renowned experience. So I wish you all the very best in your future endeavors. So thank you for joining, sir. Have a nice day. Thank you.
Thank you, Madhukar. Thank you. Thank you.
Thank you, sir. Thank you.
Thank you.